Many of us have watched this pandemic unfold before us from the safety of our homes. But an inmate at the Wisconsin Resource Center State Prison in Winnebago County has been watching it from inside prison walls. He sent our Jamie Perez a letter sharing his perspective on what's happening in the world that is out of his reach.
Right now, everyone has a story. We've told the stories of what it's been like to quarantine at home, the stories of love prevailing despite societal limitations, and now, the story of those limitations from inside prison walls. This is Jared Spencer's story. He writes, "Watching the news now feels like the only real connection I have to the world aside from talking to my family, and watching the news these past few months has felt like watching a frame by frame of a train wreck. Every time I see coverage of COVID-19, I think about my family and regret that I can't be there to help them. Both my parents are high-risk individuals. My stepdad works at a grocery store, and my grandma lives in a nursing home. I worry about them constantly because even if they do everything in their power to follow CDC guidelines, they could get sick because someone else decided to ignore them. So many people want to get back to work, and I understand why, but it really worries me that people seem willing to put the life of the economy before their actual lives. When this first started, I kind of discounted how serious it was. I kept hearing that it was basically just the flu and that it wouldn't be that big of a deal. When they started the stay-at-home orders and people started dying left and right, it didn't seem real. Clearly it is, and I just wish everyone realized it sooner, myself included. I have a lot of concerns about my family, but I'm also concerned for my own health. The biggest issue going on at WRC is that staff aren't using PPE. The on-unit staff don't wear masks, and while they have people doing temperature checks every morning, the staff who do them don't wear masks and speak in our faces after coming in close contact with every inmate in the facility. I brought this up last week to one of the staff members, and I was told that it had been discussed in a staff meeting, but no change has been made. I really worry about the quality of health care I would get if I got coronavirus, even being in a DHS facility. I just hope we get through this and that it makes us better as a result."
The DOC posted on its website that it has encouraged the use of face masks to limit exposure to the virus. They've also suspended in-person visits, admission to state prisons, travel, work releases, and all locations are practicing intensive cleaning protocols. Coming up in